this topic, tomophobia. I actually had to go look it up last night. What is tomophobia? But I'm not going to shine off him. I'm going to let him explain tomophobia to you.
It's slight change.
What it really means.
Slight.
So, Dr. Asif, yeah, take the stage. It's all yours.
It's not a problem. Mike? Good morning and assalamu alaikum. Let's talk about today's case. We have seen some very, very interesting cases yesterday, and today our sir discussed a very nice case, and hopefully my case will be equally interesting today. So, mine is the case study of a tomophobic patient with multiple hemorrhoidal complications, and how did we manage? Sir already pointed out that tomophobia is probably a new word for everybody. That's exactly the reason why I added here, so that everybody is interested. Maybe somebody looked up the dictionary for that. We'll discuss it right now. And I am Dr. Asif Al-Masok. So, in case, I know everybody knows about Bangladesh, but basic geography will tell you that Bangladesh is a country, that green country is Bangladesh, and we are about 2,600 kilometers away from wherever we are standing right now. So, what is tomophobia? Tomo means cutting, phobia means fear. That is, tomophobia means fear of cutting or fear of surgery. That means my patient is extremely scared of doing surgery, and you'll certainly see why I'm talking about that. So, my patient is a 56-year-old gentleman. He is a very, very successful businessman in Bangladesh and lives in Dhaka. So, the first time I saw him was on the December of 2022 with this complaint, something coming out of the anus for 5 years, anal swelling for 3 years, severe pain for 3 days, anal swelling for 3 days, severe pain for 3 days, and occasional bleeding. I think it's due to the occasional bleeding he never went to the doctor. That's what I expected at that time. And he has chronic constipation, and by chronic constipation I mean severe constipation. He goes to the toilet, sits there for half an hour to 40 minutes, reads daily papers, do some Facebook and YouTubing, and then goes out. So he sits there for a very, very long time. He also has family history of hemorrhoids. He is quite overweight, but does regular exercise and takes a high fiber diet. And he is diabetic for the last 25 years. His diabetes is under control. That's what he said. So, on the first time that I saw this gentleman, and on inspection, there was severe pain on this patient, and it was very difficult to do any examination. And this is what we found. Actually, this picture doesn't do justice to what the problem he had. He actually had 4-degree hemorrhoids with thrombosed circumferential hemorrhoids, and he had moderate to severe pain. I was unable to examine this patient due to his acute pain. And now there was a discussion yesterday that what do you mean by acute hemorrhoid? I think that this is what we taught in our own medical college, that acute hemorrhoid means there will be bleeding, of course, but maybe there will be some pain as well. Acute hemorrhoidal attack means there will be pain, maybe thrombosed hemorrhoid would be there, and there would be bleeding. This is what we knew when we did the undergraduate, but I think there was no exact definition of this, so there is a consensus behind that maybe. So I did an examination under anesthesia, and my diagnosis was quite straightforward. That was a 4th-degree internal hemorrhoid with thrombosed external hemorrhoids with anemia. And my plan was quite straightforward: Milligan-Morgan hemorrhoidectomy. Is there someone has any different opinion about that? This is the case. And my initial planning was Milligan-Morgan hemorrhoidectomy. So,
Any fissure?
very good question, sir. I think later I found out that this patient had fissure, but at that
he had rectal hemorrhoidal prolapse since 5 years previously. So since I don't know when, and the pain starts in 3 days before. So 3-day pain, 5-year hemorrhoidal prolapse. Right. So maybe there is something that is, of course, related to both fissure and thrombosed external hemorrhoids.
Exactly, sir, and that's very good observation. I think we will discuss about that right now.
But planning is okay.
You said this is a tomophobic patient.
Right.
He allowed you to go to a UAI.
No, actually, that is what I told him. That is what I told him. But don't think he is going right away to the surgery. He didn't actually. I asked him. I was curious about that. You are a very rich person. Why didn't you do the surgery before? And then he told me that he went to various doctors in Bangladesh, India, Singapore, even in Malaysia. And actually he was asking the same question, just expecting a different answer. The question was, do I really need surgery? And the answer was always, you need surgery. But he didn't do the surgery. He was actually looking for a magic medicine, but which was never there. He also went to some other places. I think in India, some surgeons are doing laser surgery at this present moment. He also went there as well, but I think in India, they also told them that laser surgery wouldn't be the right surgery for him. We did a colonoscopic polypectomy for this patient. The polyp was in sigmoid colon. It was moderate in size. We did the surgery. It's just a 30 minutes video, 30 seconds video. So that's what we did. We sent it for biopsy and no malignant pathology was there.
Sorry, so during the acute phase, you did the colonoscopy?
Yes, sir. After he was admitted at that hospital, because he was 56-year-old, I told him that do the colonoscopy. It's under sedation. There was not much pain over there. I did it anyways. This gentleman then told us he requested me that give me some medication. I'll just come back later. I'll do the surgery. So I did. I gave him some MPFFs. I advised him for sitz bath. Gave some topical ointments. I told him to take plenty of fiber. This is actually the wrong picture. This is not the picture I gave him. I told him to go for all chocolates and everything must be avoided. This is actually the wrong picture. Sorry for that. And there is adequate amount of water should be taken as well. So I requested him to come for follow-up after 1 month, and as usual, he did not come for surgery or for referral. He came back after 2 months, and very interestingly, fortunately and unfortunately for both of us, his thrombus hemorrhoid subsided with all those conservative treatment, but he still had the prolapsed hemorrhoids and the bleeding was still there. This was in February 2023. But he also had pain during defecation. So that's something that told me he may have a fissure as well. So I again advised him for surgery. He promised to do the surgery, but still again he just did not come. So he came back after 3 months on the July 2023. Again he came back with 4-degree hemorrhoids, with thrombosed external hemorrhoids. This time there was severe bleeding. So my answer was the same, just go for surgery. This time the pain was severe. So again, as usual, the patient promised me that he was going to come back after 1 month and do the surgery, and as usual, he did not come. He came back 3 months later. Now this time he came with this. Anyone has any idea about this sort of problems?
There is for sure sphincter hypertone in this patient, so maybe lidocaine was not enough. And you should have added nifedipine plus lidocaine in order to relax the muscle at the very beginning. But now this is a necrosis urgent scenario,
yes.
Really urgent scenario, and so in this case, the management is completely different.
Right, exactly. Nifedipine, I mean topical nifedipine, is it?
Yes.
Unfortunately, yes,
nifedipine.
plus nifedipine. Unfortunately, we don't have it in Bangladesh, topical nifedipine. It's not.
GTN.
GTN is, actually GTN was given to
I know the complication.
GTN was given to this gentleman. He is actually taking all those medications. He actually knows about this medication more than me actually. He has taken all those medications, GTN, but it has severe headache for this gentleman because small amount of GTN really doesn't do anything for him. So he was taking the GTN. He was.
Strangulated piles.
Yeah, now he has actually not only strangulated, it's actually gangrenous right now. And very interestingly, as you have pointed out, the patient really had a fissure as well. And now the patient came back with a fistula and an abscess. So now diagnosis was quite straightforward. It was gangrenous hemorrhoid with posterior fistula with abscess. And there's no question what he needs now. He needs surgery. He again asked for, he actually now has a severe pain. He again advised that whether a non-operative surgery, non-operative management is possible or not. I told him that absolutely out of question right at this moment. So after 1 year from the day I first told him that you need immediate surgery, he ultimately did the surgery in November 2023. It is actually quite an extensive surgery. It doesn't look very nice. I have to drain the abscess, do a surgery of the fistula, and also excise the hemorrhoids. So all things has to be removed at that time. And I was actually scared the outcome of this surgery may be quite grave. And he has a postoperative moderate pain, which was actually quite obvious, and we have controlled it with normal medication. I also gave him some MPFF. Now, very interestingly, this is 27th of January this year, and this is actually the final result. I was quite surprised. It did heal quite well. And that opening is not a fistula, if anybody is wondering. That is, I also thought is that a fistula or not. It's not a fistula. So this is this gentleman when we discharged him. Unfortunately, I couldn't show the picture, but he was actually smiling. So that's the case. This is my country. It's a green country. If anyone wants to come to Bangladesh, you will see the greenest country ever. This is also the land of the rivers. If anybody is interested in rivers, you can come to my country. Also the land of the Royal Bengal tiger. If anyone wants to meet the Royal Bengal tiger, we can arrange it. We have the longest sea beach, the Cox's Bazar. It's a beautiful place. You can come and have a look. So that's it. And one more thing. This is actually our own hospital. We are building it. This is actually the first and only colorectal hospital, specialist colorectal hospital in Bangladesh. This is my little brother with his son. So, thank you very much.